Ginger is one of the most popular natural remedies in the world. People use it for digestion, immunity, inflammation, and even joint pain. But here's what most people don't talk about. Ginger is not safe for everyone. And if you're over 40, especially if you're on medication, this is very important. This is educational content. Always speak to your healthcare provider before making changes. Let's begin. What ginger does in the body. Before we talk about who should avoid it, let's understand how ginger works. Ginger contains active compounds like gingerol. These compounds thin the blood, slightly lower inflammation, stimulate digestion, can lower blood pressure, can reduce blood sugar. That sounds great, right? Yes, but those same effects can become a problem for some people. People with bleeding disorders. If you have a bleeding disorder, ginger may not be safe for you. Why? Because ginger has mild blood thinning properties. It can slow clotting, increase bleeding time, make bruising worse. If someone already has difficulty clotting blood, adding ginger could increase bleeding risk. This is especially important before surgery. Doctors often advise stopping ginger 1 to 2 weeks before any surgical procedure. If you have hemophilia, frequent nosebleeds, easy bruising, please speak to a professional before consuming ginger regularly. People on blood thinners. This is very important. If you take medications like blood thinners, ginger may interact with them. Because ginger naturally reduces clotting, combining it with medication that does the same thing can increase bleeding risk. Examples include people taking medication for heart conditions, stroke prevention, blood clot prevention. Mixing natural remedies with prescription medication without supervision can be dangerous. Natural does not mean harmless. People with low blood pressure. Ginger can lower blood pressure. For people with high blood pressure, that may be helpful. But if your blood pressure is already low, you may experience dizziness, weakness, lightheadedness, fainting, especially after standing up quickly. If you often feel dizzy or have been told your blood pressure runs low, be cautious with ginger. People with severe acid reflux or ulcers, ginger stimulates digestive juices. In small amounts, that helps digestion. But in people with severe acid reflux, gastritis, or stomach ulcers, it can sometimes increase irritation. You may notice burning sensation, increased heartburn, stomach discomfort. Everyone's tolerance is different, but if symptoms worsen after taking ginger, stop and consult a professional. Safe ways to use ginger. Now, this doesn't mean ginger is bad. For many healthy adults, moderate use is generally safe. Safe practices include using small amounts, not mixing with medication without advice, avoiding high-dose supplements unless prescribed, listening to your body. Sometimes less is more. When to stop using ginger, stop and seek advice if you notice unusual bruising, bleeding gums, severe dizziness, worsening stomach pain, rapid heartbeat. Your body always gives signals. Pay attention to them. Ginger is powerful, but powerful things must be used wisely. If you're over 40 and managing health conditions, always check before adding natural remedies daily. Share this video with someone who drinks ginger tea every day. And subscribe for balanced health education designed for adults 40+. Because informed choices protect your health.